All right, good afternoon. Let me make sure that we are. It is such a treat to be here, both the environment, which is beautiful here at Oxford, as well as an honor to be with this wonderful company. I am Cassie Mogilner Holmes. I'm a professor at UCLA's Anderson School of Management, and I study the role of time in cultivating subjective well-being. In doing this work, I've become convinced that it is time, the amount we have as well as how we invest what we have, that is critical for the enjoyment we experience in our days. And today I'm going to be talking about the amount of time we have. In a lot of my work, I've looked at the amount of time we perceive ourselves of having left in our lives overall and how that influences happiness. Today I'm going to be talking and focusing on the amount of time we perceive ourselves as having in the day-to-day. Individuals across the globe report constantly being in a rush, suffering from a hectic pace of life, and this acute feeling of having too much to do and not enough time to do it is what we call time poverty. And this is a widespread issue. In a nationally representative sample of Americans, we found that almost half report being time poor. Though women tend to feel more time poor than men, and though working parents tend to feel particularly impoverished, all types of people lack for time. Time poverty is associated with feeling less positive emotions as well as more negative emotion, like stress, anxiety, and anger. We find that people who feel more time poor experience a reduced sense of meaning in their life, and we find that they're less willing to engage in behaviors that are worthwhile and fulfilling, like volunteering. Studies have shown that when people don't have enough time, they are less healthy. So they're less likely to exercise, they're less likely to go to the doctor when they're ill, they're more likely to eat fast food, which is not particularly healthy. People are also less kind, less willing to take the time to help others out. They're less confident in being able to achieve their goals and are less happy. Being, going back, I guess. Being a mother of young children with a partner who also works, I fall directly within that demographic strata of the temporally impoverished. I have felt extremely poor and have exhibited every single one of these negative behaviors and effects. And I know it was mentioned that our personal experiences and feelings, there's not a place for it in an academic conference, but I am going to share mine with the purpose of vividly illustrating the data, as well as hoping to highlight the relevance of this issue. I have felt so time poor that I considered leaving my job as an academic. I remember a night in particular earlier in my career when I was on the faculty at Wharton, and I had given a talk that day in New York, and I had almost missed, barely made, the very last train that would get me home to my 4-month-old and my husband back in Philly. Rested my head on the sort of cool glass of the window, and as I saw the blur of houses and the trees whiz by, I was realizing just how quickly life was passing by. And I was wondering if I could keep up. And it was, between trying to be a good partner and parent, pressure to publish and perform at work, it was all too much. There simply weren't enough hours in the day to do any of it well, let alone to enjoy any of it along the way. And in that moment, it was like the single conclusion I thought to this experience of time poverty was to quit. Quit my job, move to a sunny, slow-paced island, bring my husband and baby along, and I wondered, would I be happier if I had a whole lot more free time. If I had more hours in my day, would I feel more satisfied in my life? As a social psychologist, I'm like, actually, there's probably an empirical answer to this question. And so I looked to test it. I recruited a couple of my favorite collaborators. What is the relationship between the discretionary time people have and their life satisfaction and happiness? In our first study, what we did was we analyzed data from the National Study of the Changing Workforce. And in that study, it asked participants, all of whom are working, on average, on days you're working, about how many hours do you spend on your own free time activity? And what we found was an inverted or negative quadratic relationship, an inverted U. Though it's not a big effect in terms of the effect size, the pattern is very clear, and what it suggests is that, yes, so me, and I'm sure many of you actually have seen nodding heads, can relate. With too little time, there's less happiness. But it also suggests that having a lot more hours in your day to spend on free time activities won't necessarily lead to greater happiness. We wanted to test the robustness of this pattern, so we analyzed data from the American Time Use Survey, which captures for tens of thousands of both working and non-working Americans how they spent the hours of their previous day. And what we were looking to do was to calculate how many hours individuals spent on discretionary activities. Then the question is, well, what counts as a discretionary activity? Since there isn't a standardized definition, what we did was we presented all the categories activities to another group of participants, or another group, separate sample of Americans. And we pre-registered that we would count any activity that more than the vast majority, more than 90% identified as discretionary. I will say that the pattern is robust to when we use a more lenient threshold, so if more than 75% agree as discretionary. But based on this, the activities that we counted as discretionary included relaxing, so doing nothing, watching TV, watching a movie at home, active leisure activities, so playing sports, going to watch others play sports, going out to the movies, as well as socializing, so spending time with family and friends. What we found was, again, that viewing the data in a different way, this histogram shows and suggests that with less than, at least within this data set, with less than about 2 hours of discretionary activities in one's day, that is experienced as less happy, as too little time. With more than about 5 hours of discretionary activities in the day, however, you see that is experienced as too much time. You also see this drop in life satisfaction. We wanted to sort of dig into, explain this pattern of results, and with additional studies and analyses, we found that for the too little time folks, they experience higher levels of stress, and that is what contributed to their lower levels of happiness. For those of us who exist in that sort of place on the graph, this is not at all surprising that we feel stressed out and are unhappy. What is perhaps more surprising is this too much time effect. And what we found in additional studies and analyses is that Americans, and I'm going to say, this is, all of my data is among Americans, and I'm especially, among the many treats of being here, is hopefully meeting folks that with data sources that can look at these findings and look to see whether they extend across cultures. But among us Americans, we are driven to be productive. We do not like being idle. With too much time on our hands, we feel, and without anything to show for how we spend the time, we feel lacking sense of productivity and a lacking sense of purpose. And this is what seems to be driving this reduction in satisfaction with too much time. And this actually, I think, is what gets at the heart of the question that I was grappling with on the train that night, and is a nice answer to sort of discourage folks who, away from joining the Great Resignation that we are seeing in the US, is that the answer is not to quit, particularly because so many of us find a great deal of purpose in our jobs. What is also really interesting in this data is this middle sort of flat portion of the graph, because it suggests that for a pretty wide range between 2 and 5 hours of discretionary time in a day, there's not a relationship between how much time people have and their satisfaction. This is important because it suggests that, except at the extremes, which are important to understand because there are so many of us that are sort of in those extremes actually, except at the extremes, this suggests that it's not so much a question of how much time you have, it's really a question of how you spend your time and invest the hours that you do have. And so when it comes to time and your satisfaction in life, this suggests that it's not about quantity and having more, it's about quality, how we invest what we have. And then the question becomes, how should we invest the time that we have? And there is a wealth of insights in the science of happiness conducted by folks in this room, and pulling from all of those insights and applying tools from those insights. I've developed a course that I've been teaching to our MBAs and executive MBAs at UCLA for the last few years. And it's been incredible to see the wonderful impact it has had, seeing significant increases on my students' satisfaction, sense of meaning, sense of connection, as well as happiness from before the course to after the course. Seeing the impact, I then was motivated to sort of pull those insights and tools together. In the last 2 years, I have written this book, that Happier Hour, which will be coming out in US in September, in the UK in January, which is an investment guide of sorts, but for our more critical resource of time. And what I am looking to do in order, my approach to solving time poverty is to inform individuals, and at the individual level, give them the information so that they can make decisions how to spend our days so that they aren't just overly full, but that they're fulfilling. And I am so excited, again, to be at this conference because with folks here who are thinking more at the organizational level, at the community level, I would sort of urge and invite folks to think about what are some sort of policies and practices that we can put in place to offset the negative effects of time poverty. So with that, I thank you all for your time.
We found on the health side that what sometimes we'll call non-compliant patients is a time scarcity issue. If you compare outcomes, diabetic patients who's managing their diabetes, and you look at racial differences, it's not non-compliance, it's time scarcity, and the inability, if you're taking 3 buses to get to a clinic, you're just not going to show up on time. So the question on this one is, how have you looked at time scarcity, time poverty, as a multiplier of inequities, particularly place-based inequities, transportation-based equities, which get labeled as something else?
Yes, and it's such an important point, and I think we haven't looked at it, but I think what you're saying is exactly highlighting the import and severity of time poverty. If you don't have the time, it keeps us from doing very important things like going to the doctor in the first place, following what the doctor tells you to do so that you are able to take care of yourself. it's interesting in looking at the relationship between time poverty and income, there is not a significant one. And it's interesting because I think that time poverty is experienced for different reasons at different sort of levels of economic wealth. So for the extreme poor, you don't have the resources to outsource. For instance, you might have multiple jobs to make ends meet. So there you feel very time poor. You see at the folks who are higher in terms of economic status that they also feel time poor, but I think for different reasons. It's that sort of increasing responsibility and demands from outside of your individual experience and more sort of in the professional realm. And so there, with those competing pressures and demands, you see time poverty. In terms of, so I think, I guess to highlight just how important what you said is that it is critical to take into account time scarcity and how little time we have in lots of other behaviors in our life. Thank you. And also what's also interesting with respect to health, this is anecdotal with friends who are medics and psychiatrists, it's been interesting to see the uptake of telehealth and how the COVID pandemic has obviously had very negative effects in very many ways. But one positive is that patients and doctors are more willing, they've been forced to sort of start using telehealth, and that has reduced the sort of logistical constraints. Not all medicine can be treated remotely, but a lot can, and in particular, therapy. Yes.
Hi, thanks for a great talk. I was wondering if I could ask a narrow question about one of the impacts of COVID, which is the boom in remote work, and the interesting paradox that seems to be emerging from that from a time perspective, where objectively we can use our time in more flexible ways if we are working remotely or working in a more hybrid setting, but there seems to be an increase in self-reported time poverty, particularly from organizational workers. Can you talk a bit about that, maybe why that's happening, how we can potentially resolve it?
Yeah, it's so interesting because as we are working from home, as we know from day reconstruction results, commuting is one of the activities that is associated with the most negative emotion. With COVID, working from home, that removed our commutes, so we regained that time to potentially spend in better ways. But another thing that we are, in terms of well-being from working from home, and I haven't conducted this data, but basically applying some of the insights from my work to what I'm observing, is another thing that we have come to lack is that social connection. And the extent to which that comes from our workplace, that is, as we know from data reconstruction, results that the time that we spend engaging with others is sort of among our most happy. And so, hopefully we are re-engaging with those sort of around us, that not necessarily that social connection from work, but that is something that's lacking. In terms of how time poor we feel and the increase of sense of time poverty, even though we have regained an hour from not commuting every day, is it comes from this sort of lack of differentiation between the time that you're spending at work as well as your personal time, because it is all in the same space, all bleeds together. Notably, our way of measuring time poverty is subjective. So how much, the amount you feel like you have to do and the time you have to do it. By removing those barriers, sort of physical or sort of, spatial barriers from this is my work time, this is my personal time, and it all bleeds over into each other, it increases our sense that we should always be doing, we should always be on, always be working. And that is making us realize that we don't have enough time to it's exhausting, is what it is. So for all of those reasons, it will be interesting to think about, as we return to being in person, what are the smart ways to do that? Because there are some gains of not commuting every day. In the US, the average commute is 30 minutes each way, so that's an hour of your day. So maybe if we think about how not to do that every day, but how can we coordinate so that we show up at work and are able to engage with our colleagues and get that sense of social connection, get the ability to brainstorm together. There's an interesting paper that just came out about how working, sort of being remote in terms of coming up with new ideas with your group versus being in person. And what they found was that coming up with new ideas, the brainstorming part of strategy and decision-making, suffers from not being in the same place together, but actually selecting from those strategies you can do individually. So I think that as we are sort of going back to work, I mean, we've been working the whole time, as we're going back potentially to the office, how can we be smart about optimizing our time with each other in the office and at home, such that sort of all of our dimensions are all taken into account.
Thank you so much. I've always had a lot of sympathy with the view that people are getting stressed because of lack of time, and that this must be a reason for population-wide stress. But then I've always been puzzled by the fact that people are watching TV for 3 hours a day. I mean, that's just so difficult to reconcile one statement about the population with another statement about the population. So it's the reconciliation that the people who are time poor are just, you say people like watching television a lot, that's your top thing. It's a problem that the people who are time poor are just not watching enough television.
Yeah, so I actually didn't say that people like watching television a lot. Watching television was counted as a source of discretionary time, but of course there's lots of different ways of spending discretionary time. And we did additional analyses among the discretionary activities. And what we found is that the non-productive activities, so this is watching TV, this is where you see that really big dip or larger dip in spending too much time on it. And as we know, people are not very good at predicting what activities that are good for them in terms of their own happiness even. But what this also points out is this interesting thing where you actually don't see as much of a dip among the productive discretionary activities. So these are things that are like hobbies. And so what this is pointing out is that it's not so much, again, actually the conclusion is not so much how much time you have, it's how you spend the time. And so, I'm often asked among retirees, for instance, if they have so much time, then aren't they all unhappy? And the answer is no. It depends on how they're spending the time that they have. And work shows that retirees who spend their time volunteering, which is experienced as purposeful and productive and worthwhile, you don't see that dip in life satisfaction. So all to say, we should not be spending so much time watching TV. Thank you.